Hello everyone, it's Dr. Teba and today we will talk about the kidney ultrasound, normal versus abnormal appearances. We will do a comparison between the normal and abnormal appearances. We start off with the normal views. The first one is a coronal view. We can see the left kidney and the renal parenchyma, which consists of cortex, the outer region, and the medulla on the inner hyperechoic area. But in this image it is not very clear the medulla. And we have the hyperechoic region, which is the renal sinus fat, because it has fat getting more dense and it appears hyperechoic. And below we can also see the renal pelvis, but we cannot see the ureters because normally we don't really see the ureters. And in the longitudinal view we have the liver, the right kidney. Above that is the liver and we can appreciate the kidney. It has the outer cortex and the renal sinus, which are very well visualized in this picture. Next view is the transverse view. It is a cross-sectional image of the kidney, and here we can see the right image. We can see it more clearly. We have the cortex and the renal sinus very well visualized, and above them is the liver. And here we can see some of the renal pyramids, and we can also see the renal pelvis. The first case is the renal cyst. This is a simple renal cyst test to get it. In this region, we can see it's very round and it will have posterior acoustic enhancement. This is our typically feature of our cyst. It will be round, it is anechoic and it will have enhancement. And this is another appearance in the longitudinal view. It is more detailed and you can see this in the upper pole of the kidney, right kidney upper pole. This is again the acoustic enhancement which is behind the cyst. It will be hyperechoic region. Because more ultrasound rays are passing through the cyst, so it gives enhancement. In polycystic kidney diseases, we have multiple cysts around anechoic structures. With posterior acoustic enhancement, there will be multiple of them. There is one in the cortex we can see in the transverse fields, the renal parenchyma. Most of them are in near the renal sinus or the medullary region, and there will be more than one. It is an inherited disease. A longitudinal view of the right kidney. There are multiple cysts again with posterior acoustic enhancement and anechoic round structures. Now this is the longitudinal view of the renal stone. In this you can see there's a stone lodged in the kidney and it has shadowing. It is followed by a stream of dark regions, and this is whole kidney and we have shadowing behind the hyperechoic stone. We have another image in the transverse view, a hyperechoic stone followed by a dark area of acoustic shadowing, always behind the stone. Stacon calculi are large calculi which involve the renal pelvis and at least two calculus of the kidney. This have heavier shadowing, but this is just a transverse view, so we cannot appreciate it as well. The one in the longitudinal view, we can see multiple stones which is involving a much longer region as compared to the solitary stone we saw either, and we can see one shadow acoustic shadowing here and another one acoustic shadowing here. Behind the stone, pyelonephritis is an infection of the kidney and it really involves the renal pelvis and the renal parenchyma, and it can cause abnormal echogenicity in the kidneys. The regions that are hyperechoic, they are due to the hemorrhage, and the regions that are hypoechoic, these are due to the edema. The transverse view of the pyelonephritis shows us the hyperechoic area and some hypoechoic area. It is overall heterogeneous appearance. We have to correlate these clinically as well. Another longitudinal view which houses the medulla as well, and we can see the abnormal echogensity, the hyperechoic regions. Nephrocalcinosis is a condition in which calcium is deposited in the renal parenchyma. Most common location is the middle, and we can see the hyperechoic regions. These are the calcium deposits throughout the medullary regions. The density of calcifications is more in this image, that's why it leads to shadowing. Posterior acoustic shadowing is another one over here, and this one is also in the medullary region. It has occupied the medullary pyramids.